respiratory pathology, Pancoast tumor, as well as superior vena cava syndrome. All right, this is the final two pathologies that we're going to be discussing within the respiratory chapter. And honestly, I'm happy that they're together just because I used to always confuse them. These were my least favorite topics, so I'm going to hopefully clear this up for you guys. So all Pancoast tumor, it's also called a superior sulcus tumor. All that it is that you have a tumor within the apex of the lung, okay? And when there's tumor at that location of the apex of the lung, there's so many different things that it can compress on, because remember, just anatomy-wise, there's so much structure, so much vasculature, as well as nerves that run through that area, okay? And so the Pancoast tumor has an ability to cause compression to all of that structure, okay? And so if you ever see apex of the lung tumor, start thinking Pancoast tumor, number one, okay? But sometimes, the majority of the time, they're not going to really give you that. So the way that I think about Pancoast tumor is weird symptoms, okay? So you're going to see neurological symptoms. And one example is Horner's, okay? So you can have Horner syndrome, right? Which is a compression of, the stellate ganglia, right? And you're going to see ipsilateral ptosis, meiosis, and anhidrosis. And we'll discuss that later on in the neurological chapter. But when you have Horner syndrome, all that it means is that you block the sympathetic nerve to the face, okay? So you no longer have sympathetic nerve input to the face, and so the parasympathetics take over. So that's why you get ptosis, which is just drooping of the eye. You have meiosis, which is just the eye, the pupil is pinpoint. It's very, very constricted. And then you have anhidrosis, which is the inability to sweat. Okay, so that's the blockage of sympathetic input to the face is known as Horner syndrome, and it's seen with Pancoast tumor because it can compress the stellate ganglia. Another thing you can see is recurrent laryngeal nerve issues, compression, and that can lead to hoarseness, right? But one of the favorite things that they love to ask about is going to be essentially atrophy of the hand muscles, okay? And so you're going to get atrophy of those hand muscles, which is so weird to see, but it's because we have compression of those C8, T1, and T2 nerves, okay? And so if you see atrophy of the hand muscles with some type of tumor, you're going to be dealing with Pancoast tumor, all right? Also, Pancoast tumor can lead into our next pathology, superior vena cava syndrome, okay? Superior vena cava syndrome is just obstruction of the superior vena cava, right? So the Pancoast tumor can compress the superior vena cava, the SVC, and it can lead into SVC syndrome, all right? So keep that in the back of your mind. It can be confusing. Pancoast tumor can cause SVC syndrome, but SVC syndrome cannot cause a Pancoast tumor, right? Okay, that's pretty straightforward. So Pancoast tumor has neurological symptoms. For SVC syndrome, okay, you're going to have obstruction of the SVC, and so we have essentially an inability to drain everything above the head, okay, back into the heart. So we get facial plethora, right? And that just means that the face is just like full of blood. So when I push on the skin of the face or on the skin above the SVC, you get these blanching after the fingertip is pushed down, okay? You can also get jugular venous distension, all right, and edema above the SVC, okay? It can be caused by mediastinal mass or a Pancoast tumor, as we already discussed. And the most common, though, once again, is the mediastinal mass. Even though Pancoast tumor can cause SVC syndrome, mediastinal mass is more common. But there's no neurological symptoms associated with SVC syndrome, right? Unless it's a Pancoast tumor that's compressing on other nerves, all right? So I just want to make that clear. A question that they like to ask is like drainage. If you have SVC syndrome, what is actually still able to drain back to the heart, all right? And so don't get rattled with it. Just look at the options that they give you and see what's at the level or lower than the heart, and that will still be able to drain back. Anything above the level of the heart is unable to drain back. So look at the names, be able to kind of use deductive reasoning to kind of cross off anything that you don't know that's above the SVC or above the heart, and then you should be fine, all right? So that's all for Pancoast tumor and SVC syndrome. Relatively lower yield, but just keep in mind the Pancoast tumor has those weird neurological symptoms with the atrophy of the hand, the Horner's, as well as potential SVC syndrome. And then SVC syndrome is usually commonly caused by mediastinal mass, and it's just obstruction of the SVC, so you get facial plethora and blanching of the skin after fingertip pressure.